Hi, I'm Justin K. Hughes, licensed professional counselor. So when we experience fear, there's a natural tendency to want to avoid, neutralize, suppress, or seek safety when we experience that. However, if it's out of context to a situation that is not an immediate threat, it tends to reinforce fear when we do these things. Exposure therapy is the psychological treatments in behavioral therapy and cognitive behavioral therapy to systematically confront fear and to change fearful responses. So it increases confidence and decreases the disruption caused in a person's life. And over time, when a person engages in these ways, ultimately it tends to decrease discomfort. Now, it's indicated for many disorders. It's actually a first-line treatment for PTSD, generalized anxiety disorder, body dysmorphic disorder, even at this point, some great research on depression and certainly panic disorder. It's considered the gold standard treatment or the best treatment for OCD, phobias, and social anxiety. However, it's underutilized as it's only applied a minority of these times. How do you do exposure therapy? The principles of exposure may be simple, but there's a lot of working parts, and they must be personalized to each individual. First and foremost, assessment is key. Ongoing assessment is essential, but doing good assessment up front to understand what is the disorder or problem that's being treated. Would the person benefit from exposure therapy? If there's other diagnoses, comorbid conditions to treat, all of these things are very, very important to look at. Second of all, education. I'm going to educate a person along the way about their condition or disorder, how to work with it, how treatment can help them. And then we move into planning. This is going to involve things like tracking a person's symptoms, thoughts, behavior surrounding the topic that we're treating, and doing things like building a hierarchy, 1 to 10, things that are easy to face, hard to face, understanding a client's core values and the targets of what they want to work on. We move into, from there, formal exposure. These are the practices where we systematically confront the fears that a person has and help to decrease the fearful responses. Throughout the process, I'm going to utilize some cognitive therapy, although it's usually a smaller part, depending on the person, of exposure therapy. The cognitive therapy aspect would involve decreasing negative thoughts, challenging unrealistic beliefs, or faulty misappraisals. Ultimately, we'll look at adjunct supports as well. So this could be utilizing motivational interviewing, acceptance and commitment therapy, dialectical behavior therapy, mindfulness, etc., to help facilitate the best outcomes, highly personalized to each individual. And then the last part of treatments would be relapse prevention and looking at long-term recovery. What does this look like? And especially if terminating therapy, what does this look like in day-to-day life? I'm Justin K. Hughes, licensed professional counselor. Follow me on any social media platform or go to my website and/or blog at justinkhughes.com for much information and many free resources.